Good morning, everybody. So I'm here at Memorial Plastic Surgery. I'm about to get my vampire facial, and it is microneedling and PRP. I feel like my face needs it, so I wanted to try something new, and this is what people recommended me. So we're here in the office right now, and if you guys want to take a look. We were watching vlogs, and I just seen people inject, like some of them I guess don't use numbing creams, and some...
Oh, we are using it, honey.
Okay.
By the time we're all done today, I guarantee you're going to say, oh my god, that wasn't nearly as bad as what I thought it was going to be. On a scale of initials, those two areas highlighted, and then we'll do the next page. Here. Print your name and sign. Okay, perfect. And are you allergic to any medication? No. And you said you've never had this done before.
No.
Are there any specific areas that you want treated or that we want to target today? What bugs you?
I'm not sure what exactly this is going to help with. So
Everything.
Everything, okay.
Mm-hmm.
So I was telling my friend, I was like, so one thing that does bother me right now are these lines.
Okay.
So I don't know if that will help with it or... And also redness, does that help with?
It does.
Okay,
It
I don't
does.
know if I have like rosacea or something, and it's just the stubborn red areas are not going away with anything I put on.
Okay. It actually does help. It's a good treatment for patients that have rosacea because we are going to be putting in all of the growth factors from your plasma into your skin. It'll be a very soothing, rejuvenating process. You'll notice that areas that have fine lines, wrinkles, hyperpigmentation, even some areas of melasma. I noticed that it did help on my melasma, which is crazy because a lot of things don't really work that efficiently on melasma. Acne scarring, all of it. It helps with everything. You're going to notice that your skin is going to be, the tone is going to be better, more even. The texture is going to be smoother. You're not going to need as much makeup. It's a wonderful, wonderful treatment.
Perfect. Because I was like, I have like the rosacea, I have like acne marks that like are very stubborn and not going away. And these lines just keep getting deeper and deeper. I was like, what is it? Or what can
It's
help?
gravity.
Like,
It's down and in. It's gravity. Damn it. No one likes it. It affects everybody.
Something.
Of course.
Perfect.
Okay, well go ahead and get comfortable.
Yeah.
Are you wearing any makeup at the moment?
Just lipstick and eyeliner and mascara.
Okay, perfect. I'm going to have you put this fabulous headband on. This is because I don't want to get any of the numbing cream in your hair. Try and have your hair as covered up as much as possible. There you go.
I could wipe my makeup off.
Perfect. Oh, I'm going to take care of all of that. Don't worry. Perfect.
Should I clip it or?
No, it's good because you're going to be laying back.
Okay.
So I don't want you to have like a clip or any kind of ponytail that you're laying on that could cause any discomfort. Go ahead and get comfortable. If you need an additional blanket or anything, let me know. I can also get that for you.
You're fine.
How do you feel?
Nervous. I feel nervous. But I feel like I'm in good hands. She explained everything well, so.
And I'm going to walk you through the
excited.
entire process. So don't worry, you're not going to be alone in this. I promise you. This is honestly and trust me, I've done so many things to my face. When people ask, well, what all have you done? It's like, where do I start? I guess start from the top. But literally, I've done everything. And I feel like this particular treatment has been the biggest game changer for my skin. Okay, lift up, chin up nice and tall. Perfect. So I'm just going to clean everything off. But all the things that bother me, like I have previous scarring, hyperpigmentation. I'm really bad about getting post-inflammatory hyperpigmentation. So any area that I have like a breakout, it's guaranteed to have a dark spot afterward, just as like a little reminder, like, hey, I was once here. But the microneedling will help with that significantly.
Is this something you would recommend for like the first time, or would you do something else like for me?
Oh no, absolutely. I think this is a wonderful place to start in patients that just want to have, the benefits of anti-aging, preventative treatments. This is a wonderful option. It's nice to do this. Probably every 6 weeks is a really good interval of time to have the treatment. And most patients get the best outcomes after about 3 to 4 treatments. But it all just kind of depends on what we're treating. Some patients may come in and have pretty significant dark spots or acne scarring. They may need more treatments, like a lot of clients that have, scarring along their cheeks from really bad acne when they were younger. They usually need more, like 4 to 5 treatments, but you will get resolution of the textural abnormalities, and your results are essentially permanent. Once you have that collagen remodeling, they're going to be permanent, and it's a wonderful treatment to have as maintenance. Okay. So it's good to combine the two once you get older, which you're so young, but once you get older, then it may be something to start talking about in terms of like laser resurfacing. Okay, so this is the numbing cream I'm going to apply. Okay, feel a little cold. And this is prescription strength numbing cream that combines benzocaine, lidocaine, and tetracaine. So it works very fast. And most clients, whenever we do the treatment, they're so concerned about pain. But once we start the treatment, they're like, this actually tickles. Because they're so numb. And the feeling is it's weird, like feeling your face be numb. But this is a treatment that you definitely want to be numb for.
That's good to hear, because I don't want to feel anything.
Exactly. So what's going to happen after your treatment is immediately after you're going to be very red. Your skin is going to look like you've had a sunburn. It's going to feel like sunburn, windburn for the rest of the day. It'll be red this evening. Tomorrow when you wake up, the redness will be significantly improved. And you'll be able to, I try to tell my clients not to wear makeup for 24 hours. And that's more for infection risk. If you'd had to wear makeup, you could. I'm not a huge fan of that. But if you had to, you could. Just make sure that you wear like a light mineral-based makeup, and make sure that you have clean sponges and brushes that you use to apply it. Day 3, you may have a little bit of dryness. The redness should be pretty much almost gone at this point. You may have a little bit of light flaking or peeling. In day 4, you should be good to go.
Perfect.
Wonderful little over the weekend refreshing treatment to have done.
I was like, what am I going to do with my face? I needed something.
Of course. This is a great place to start. Great place to start.
So looking at my face, how often do you think I need to be here? Should I do this every 6 weeks or?
Depends on what your concerns are, honestly, and what you're looking to achieve with your treatments, like what your aesthetic goals are. Some people want to have that like porcelain doll skin, and we can get you there, but it's going to take obviously like more treatments. Okay. A lot of clients usually come in and get, on average, like 3 to 4 PRPs over the series of 6 weeks between treatments. But it just depends. Everyone's goals are different.
I'll be back.
I'll be here. Sound like Arnold Schwarzenegger.
Right. I want a nice, smooth face.
Everybody does. So I just like to make sure we get a nice, even coating of this numbing medication on you. Some of the areas that are a little bit more sensitive during the treatment are the top of the lip, aka the vermilion border. So we make sure we have a nice area. The cheeks are an area that we can actually go a little bit deeper on safely, as well as the chin. And the nose is a fun little area to treat, because everybody, when I go over the nose, I usually save it for last. But people are like, this is tickling. Like, I'm either just going to start dying laughing, or I'm going to sneeze. Like, one of the two. It's not painful. It's not painful. So what encouraged you to come in today and get this treatment?
The redness on my face. I was looking up everything, and I started asking my friend, and she was recommending the vampire facial PRP microneedling. I was like, it sounds painful, but I'll try it.
Well, you should get that friend a Christmas basket this year. So. Do you have a preference of which arm we draw blood from?
Not really.
Does one arm or the other have better veins?
I have no idea.
I will take a look then. I'll probably actually come over here. That's okay. Of course, Amber's like, always make me move my location.
I'm always like standing with you.
Well, if it's easier, do you want me to bring it in here? It's in the supply room. It's not the most glamorous location.
Yeah, let me bring it. Sorry. sorry, Josh.
That was fine.
I'll stop now.
No, you can
Like,
get
you'll just see like black things
everywhere.
It's a vlog, so we don't really, we don't have
Perfection.
big
Edit.
perfectionists to it. It's just get it done.
Yeah.
Oh, I'm nervous.
Don't be nervous. Don't be nervous. Don't be nervous.
How do you feel?
I'm nervous.
Don't be nervous. You brought your veins with you today, so all is well.
I was like, I didn't eat.
Didn't eat.
I ate a bar that was outside. You didn't tell me I needed to eat.
No, you don't have to eat for treatment. Okay, big deep breath in. Ouch, ouch. Hard part is done.
Not bad.
Don't hold your breath. Look at this. Beautiful.
I'm scared to talk. No.
This is where all the magic is going to happen. One more vial left to go. We like to tilt the vacutainer back and forth just so the solution that's in there is the anticoagulant citrate dextrose that's in the vial that prevents the blood from clotting. So we like to agitate it. And all it takes is 2 vials. 2 vials should give us about 6 to 7 cc's of platelet-rich plasma. It's beautiful. So I'll use 1 syringe of it for the treatment, and then the second syringe I will actually send home with her, which is nice because I like my clients to be able to continue applying plasma during the recovery phase.
I was just about to ask. I was like, what do I use that for?
Yes, you just roll around in it, basically. No, not really. Oh, you're just going to continue to put it on your face. It's going to help speed your recovery, decrease your downtime. The redness will get better significantly faster. I love using plasma as well on clients after they've had laser resurfacing treatments to draw 2 vials of blood because from a centrifuge standpoint, it balances. You can't have a wonky centrifuge.
Centrifuge. Turning into separating your plasma from your,
My face is numb. Like this right here is like, I feel weird. I was nervous. She said this part was like gonna be the hardest part, which it felt a little pinched, but she's really, really sweet. She's talked our way through this so far, and really, really nice. It makes me feel, at ease. So if you guys want to get a vampire facial, come to Memorial Plastic Surgery, where they treat you like family, and they're really sweet here. I love everybody here. And I'm still nervous. I'm scared. I don't want to get injected in my face. I'm trying to play it off like I was all cool, but I'm really nervous. I feel more nervous than when I was getting my BBL done.
Okay. So for me, the weirdest part, hold on, we're in focus. For me, the weirdest part is the taking home your plasma. Like, is that normal?
I don't know. I don't even think we saw it in anybody's vlogs. Everybody just like placed their own plasma on, and then that was it.
So she get to take home her plasma, and she had to like drink 2 tablespoons a day.
Shut
and
up. She
no,
did not
I'm just
say
joking.
that.
So that's gonna be weird to see her like just spreading plasma on her face like it's makeup. But I guess so.
Can I put it on your face?
That's disgusting. That's not my plasma.
Really?
That's how you get sexually transmitted diseases on your
Joshua,
face.
Why would you say that?
I don't know.
Oh, turn off the camera. This dude is retarded. I'm ready. I wanted to take you guys through this journey, this quick, probably an hour journey, but a lot of people have been asking about, beauty stuff and facial stuff, and my skin really needed it. Like you guys saw earlier with the close-ups, I have rosacea, I believe. It's like really, really red, and it's not going away. I've tried everything. I tried organic stuff. I tried, products over the counter, and it's not going away. So I was like, you know what? Let me chunk up this big money and see if it really works. But everybody who's had it done, loves it. All the reviews I've seen are, amazing. So I wanted to get this done, and hopefully, after 1 or 2, 3 sessions, it should be fine and, better. But a lot of people said after 1 session, you'll see a lot of results. So let's just cross our fingers and pray that this goes well.
And we're going to go over here to the microwave, aka the centrifuge. Centrifuge. Yeah. Put up there a little bit.
Brushes.
Okay.
But I don't know. Clear cell?
No,
What is that?
I forgot the name. Neutrogena.
Neutrogena.
Okay,
Yeah,
so you can get those little clarisonic brushes that are really good at getting dead skin cells, dirt, bacteria, all of it off of your face. You can get them on Amazon for significantly less than you would buying a clarisonic. I think that's the most important thing to prevent future breakouts, just to make sure that you're cleaning really well. And then honestly, everybody should be on some type of retinoid. So that's Retin-A, or actually there's one that I like a lot. You can just get it at CVS or Walgreens. It's called Differin Gel. It's a Dappling gel. It's nice because it will cause cell turnover. It'll help decrease the appearance of dark spots, fine lines, wrinkles, overall tone texture of your skin. You can use it every night. That's the goal. But when you initially start it, I would do every other night, just to make sure that your skin can tolerate it and that you don't get too dry or too irritated. And you need to mix it with a moisturizer and use it at nighttime. And that's a good start. And then see how that, how your skin responds to that, what type of results you're getting. Worst case scenario, if it got worse or if you still weren't happy, you could come in and do a PRP treatment. It helps with all of those things. Or even a chemical peel. There's all kinds of fun little things to do.
Okay.
Love them. There's a peel that I love to use. It's actually by a company called Exuviance. You can get it at either Amazon or at Ulta. And it has a box of peels. One box costs, I think, with tax, roughly $85, $88, but it has 12 peels in it. And I like to do, you can do them twice a week because they're very gentle, but I like to do it once a week. It's a no downtime peel. You're not going to have any peeling. It's just going to get all those dead skin cells, dry skin, all that off of your face, and you're going to notice that your skin's going to look a lot smoother, the tone's going to be more even. It's just a wonderful peel, and you can't beat the price. For 12 peels, $88, oh my god, it's amazing. But I love those. I try to do it once a week. I've even forgotten before and left it on for hours when I was cleaning the house. And nothing bad's going to happen. You cannot mess it up. It's just, remember the old school oxy pads?
Yeah.
It's you wipe one pad on your face, and that's the activator pad. You let it sit on for about 15-20 minutes. Like I said, I've left it on for hours before. Nothing bad's going to happen. And then you use a neutralizer pad that comes with it. Step 2. And then wash your face. Moisturize. That's it. It's a great treatment. I love it. It's a good product. User friendly.
I'm gonna have to get links from you for all that.
Of course. I actually have a photo on my desktop of it because I recommend it so much to people that I can just click and print.
Thank you for the recommendations.
Of course.
I can't move this. Can't put that on the window.
Did you mess up my camera?
What?
No, I'm joking.
I was like, what'd you say? One thing that's been bothering me after surgery that I've never had is my breakouts on my back. I never had back acne, and now it's getting crazy. I don't know if it's because it's the Houston heat and the faja, but I'm going to show her. I just changed into a bra and panties to show her my problem areas on here while the blood is in the centrifuge. So this is the issues I'm having right now. It's really, really bad. The incisions are here, but now I'm also breaking out I don't know if it's the heat rash or what is going on, but it is spreading really bad.
Let me see.
So, anyway, I'm scared.
What are you scared of? You've got to be
No.
super numb by now.
Oh, no.
So are you doing a follow-up?
No, I was gonna
She
actually
wants to show you her back
My
knee
back.
quickly.
after
Okay.
my
Just-
surgery.
Okay.
I think the garment like started making me break out. I never had breakouts in my back.
Okay. Uh-huh.
So I don't know, what would you recommend for
I would recommend something with salicylic acid in it, because salicylic acid is actually going to go in and kill the bacteria that lead to breakouts. A scrub with benzoyl peroxide, like a body scrub. Get something you can get on Amazon. You don't have to break the bank for it, but something with a good, like, at least 5 to 10% benzoyl peroxide. Scrub it in the shower. Put your salicylic acid on it, and don't pick it.
Oh.
Leave it be. It's easy to reach back and scratch it, but you're gonna get dark spots if you keep doing that. Because Asian women have a tendency to hyperpigment after breakouts. Don't do that. Worst case scenario, we can laser it and take care of the dark hyperpigmentation, but we have to be very careful and use very judicious settings. But I would recommend doing that for now. If it didn't get better, then you could come in and we could do a VI peel on it.
Perfect, okay.
But that's kind of an uncomfortable place to have a peel done on your back. So
Perfect, okay. I just wanted to make sure.
look at the beauty.
Whatever thing I saw you.
No, I didn't buy it because on Amazon they were saying that the stuff started changing the ingredients. So I was like, oh, I'll just go buy it at the store.
Because, yeah, my husband had bad acne at home.
And it helped? Okay.
What product?
Penoxyl? Is it Penoxyl?
Minoxidil.
Penoxyl.
Oh yes, that's just a benzoyl peroxide
Yeah.
wash. I was about to say minoxidil, like that's for hair growth.
Well,
Girl,
he needs that too.
we use this.
PRP after his chemo.
Aw,
I know, that's sensitive.
Papa.
Taste
Papa's.
it.
He used to have really thick hair, that's why.
He did?
Yeah.
What type of chemo did you get?
A mix of crazy cocktails before his stem cell transplant. At first it was rituximab, that immunotherapy, and then after that it was a lot of things that I don't remember anymore.
You blocked it out.
Yeah, but it was like intense for maybe 5 days before his stem cell.
Mm-hmm. You're gonna say, don't recap. Shouldn't be recapping. It's okay. I'm an expert. All right, you sweet little nugget. Dun, 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 dun. Just kidding. It's not bad. Okay. What I like to do, scoot up a little bit and bring your chin up nice and tall. Perfect. So what I like to do is start. I don't wipe the numbing cream off until right before I treat the area. Okay, so that you stay as numb as possible. So I'm going to wipe off the chin from the center of the chin over and also above the upper lip. And then we will get started. And I'll do a little test pass just so you can see what it's going to feel like. I feel like you're going to be pleasantly surprised. Just saying. It's only because I've done a bajillion of these, but
My lip is numb.
it's going to be very numb. I'll make sure we get all of this cream off. It's some tough stuff. That's why we like it. I'm so excited for you.
You're fine. You're fine.
You need to send a thank you note to the friend that convinced you to come do this. Just saying. What's her name?
Diana.
Thank you, Diana. Come see me, Diana.
She has her own ways of getting treatment. She used to work here.
Hi, Diana. Hey, girl. How you doing?
She would probably love you.
Right.
Yeah, she would love you.
Come and hang out and drink some champagne.
She's really cute.
Okay, dokie. The sound is a lot worse than what the feeling
Just tell me to
is,
move.
okay? So I'm going to
If
put,
you
this is
need
your
me to
plasma. Look at this. Isn't that beautiful?
That's so different.
Liquid gold. Your body worked hard to make that. So we're going to put a layer of it on your face. Nice little light layer. It's very much like a serum in its consistency. It's actually what has all of your clotting factors in it. And this is our single-use cartridge that we use with the skin pen. It's going to be loud. Okay, you ready?
Mm-hmm.
Oh my gosh, is that the most painful thing you've ever felt?
I don't feel anything.
Exactly! And that is maximal death, you silly little rascal. Okay, you ready? Let's do this. So any areas that you feel the skin pin kind of catching on a little bit, you feel that drag? That's actually scar tissue from previous breakout. And what those needles are doing as they go in there, not only are they pushing that plasma into your face, but they're breaking up that scar tissue. That unhealthy collagen that we don't like that causes those textural irregularities, it's breaking it up. And the goal with any of these treatments is pinpoint bleeding. That's how you know you're at the appropriate depth for the area that you're treating. And that's exactly what we're starting to get here. Any video that you guys see online that has a patient with significant bleeding, don't go to that provider. It's too deep. How does that feel?
Good?
Any pain?
Uh-uh.
Okay. So the cheeks, we can usually go safely at a higher depth. And we're starting to get that beautiful pinpoint bleeding that we're looking for.
Yeah, I'm out of shape. My arms are getting tired holding my phone. That means I'm really out of shape. Yeah. One's a time lapse and one's a video.
Huh?
One's a time lapse.
Oh.
You know what I mean? I'll send it to
I
you.
got you.
Still doing good?
Mm-hmm.
Okay, pain score from 1 to 10. 0 being nothing, 10 being the worst, most wretched pain you felt in your entire life. Where are we at right now?
In between 0 and 1. I felt
Oh
little
my
pinches.
goodness. And what did you think we were going to be at?
Like a 5.
Man.
But
This
everything's
isn't Helga's
good.
House of Pain, girl. We want to make you look beautiful with minimized pain, minimized downtime.
So you said wherever it's hurting more, like a little bit more, is where the scar tissue is?
Yeah, if it starts to kind of catch a little bit, you feel like, you know, it should glide smoothly. But sometimes as it kind of catches up a little bit, that's where there's some scar tissue from previous breakouts or previous scarring of any sort. Wherever there's textural abnormalities, you'll feel it kind of catch a little bit.
I wish I had more arms.
Why don't you create like a little octopus thing that holds
I sure
multiple
would.
cameras? I'm going to go over your top lip. Sometimes this can be a little bit sensitive. You okay? Okay. So that portion of your face is done. We're going to do the forehead now. The forehead can be a little bit more sensitive because the skin is thinner in this region. So I always like to kind of dial back the depth and just go incrementally to make sure that we still get the clinical endpoint of pinpoint bleeding. But we also want to make sure that we don't go too deep because it can be a little bit uncomfortable here. Just because the skin is thinner. And especially when you get old and crusty like me and you've been getting Botox for years.
You're not.
The muscles are thinner in this area of the face, so it can make it a little bit more sensitive.
There's not
Krusty
only
the clown.
crusty.
Maybe use all the plasma on her forehead.
Shut up.
Forehead.
I can't stand you.
How you doing? You good?
At this point, I don't feel pain. It's just gliding over. I don't even feel the needle.
It's just more the pressure and the vibration, right? If you need to move that back over here, you can. So this appearance, this is exactly what you're going for with these treatments. Anything more severe than this, it's not needed. You're still going to get amazing results. You don't have to be crazy aggressive. You can be more aggressive on areas where there's more skin thickness, such as the chin and the cheeks. That's areas where you do have some deeper scarring in most cases. But this actually, for those of you medical dorks like myself, this actually almost mimics the appearance of petechiae. So this is exactly what we're looking for. Her skin is responding beautifully. Clients that are on chronic anti-inflammatories, we like to tell them if they can tolerate not being on it for 48 hours or so, to try and not be on it, just because you actually, it seems counterintuitive, but you actually want the inflammation. The inflammation, because we're purposely creating these injuries in the face, this is what's stimulating your body to go in and deposit more elastin, more collagen, do tissue remodeling through the epidermis. So you want the inflammation, you want the redness. Sounds crazy, I know, but you want it. Inflammation equals results. So we are done with half of your face. Wipe away the carnage so that it doesn't look all like crazy.
I don't like leaving dried blood on my patients.
I have to go work like this?
Call
You
in
want to work
sick.
after this?
Yes.
Heck.
Right.
What time
In your picture.
They're pinching more.
Up top.
It doesn't hurt. It's like,
So to all of your followers and friends out there, based upon what you said when you came in here, that you were super nervous about the pain and how it was going to be, are you nervous now?
not at all.
not at
I
all.
strongly recommend for anybody with skin problems on their face to come get this done.
Yes. Everybody's doing it, people.
If you're in the Houston area, make sure you come visit Memorial Plastic Surgery and get this done.
We're round in third. Doing good.
No pain still.
And to me, that's the most sensitive area. The forehead, I feel like, is more sensitive than anywhere else just because the skin is so much thinner. So, you made it through that. You are good to go. So for the rest of the day, your skin is going to be very red. It's going to feel tight as the plasma dries. And like I said, I'm going to send you home with more plasma to use later. At this point, the only products that I want you to apply to your skin for the next 48 hours are products that are super gentle. So nothing that has any kind of alpha, beta, salicylic acids in it. We don't want to get your skin irritated. You just want to have something that's soothing. This is not the time to try new products.
Okay.
This is not the time to introduce yourself to something that you've always wanted to try or to get a sample from Sephora. Do not do that.
Okay.
Because we basically created all of these micro pores in your face. And if you did have a reaction to anything, it would be exponentially worse. So you just want to use a super gentle moisturizer that you're used to, that you've used before. Aveeno's a really good option. They have an overnight facial hydrator that's fabulous. It smells really nice too. But it's nice to put it on and go to sleep. Mix it with your plasma. This evening when you shower, treat your face like you would if it was sunburned. So no crazy scrubbing, no hot water to it. Lukewarm water, pat dry, and you cannot moisturize too much. Okay, if your skin feels tight or itchy, moisturize. If it feels uncomfortable, moisturize. But the redness will be substantially better tomorrow morning. And then day 3 and 4, you may have a little bit of light peeling or flaking, but it shouldn't be anything crazy. Definitely not like what you would see if you did like a chemical peel or something more intense.
Okay.
Okay. I've actually had clients fall asleep during this.
Does it take a while to see results?
I feel like, honestly, once like the peeling and redness goes away, usually day 4 or 5 after, I personally feel like whenever I do this treatment on my own skin, I can already start to see a smoother complexion, more even skin tone, and resolution of some of the fine lines, dark spots. The results are going to continue to improve over time. And the results are essentially, assuming you know, do your homework, you still wear SPF, don't go in tanning beds, don't pick at any breakouts, your face is just going to continue to get better as long as you keep getting these treatments done. It's a wonderful, like, you okay? Semi-permanent treatment. So just as long as there's no additional, like, trauma that occurs to the skin, the areas that have improved or will just keep on getting better. Have a little scarring down here that we got caught up in. Good old hormonal chin breakout.
That's a cool skin that is so stubborn there.
You can actually get Botox in your chin. For like people that have a dimpled chin, you can get it. It will smooth the muscle out, but it actually helps with breakouts on the chin as well.
I didn't know that.
Because it calms those oil glands, the sebaceous glands, calms them down to where they're not functioning. Yeah, basically anywhere you get Botox, you're going to see the skin. The pores look smaller. It's just wonderful. It's the best. I think if you drew my blood right now, it'd be about 30% Botox.
Is there an age you would recommend for people to start, you know, getting Botox?
For preventative measures, I actually, believe it or not, and I was in anesthesia school at the time, but I was always having to wear a scrub hat, and I started getting this deep wrinkle around the top of my forehead. So I started getting Botox at the age of 26. And the amount that you need at that period is like much less than what someone, say, who's in their 50s or 60s that has pretty significant wrinkles. The amount, see, you sound surprised.
At this point, well, after this, do you have to inject anything, or is it?
This is it. Some people will come in and get what we call like a vampire facelift, where you can inject plasma into certain areas where you're already having some deeper wrinkles. But that's a very short-lived. It's not a permanent solution. Your body will essentially absorb that plasma over a period of 3 days, and then the area that's injected, and will go back to looking the way it did beforehand. It will help, but it's not going to help as much as, say, like filler would.
Okay. And how often and how much should I put of the plasma on?
It's going to be more whenever you put your moisturizer on. I want you to actually combine it, mix it in with your moisturizer, and then just use it until you run out.
Okay.
But usually for the first couple of days, that'll be plenty to get you through the downtime. You don't have to do anything fancy with it. You don't have to refrigerate it or, keep it at a certain degree. It'll be just fine because you're still going to get the benefits of it.
And you said which Aveeno product?
I like the overnight hydrating facial, but like I said, if you've never used Aveeno before,
don't use it.
Yeah, don't use it. Just use something that that your skin will not react to, that it's going to be nice and gentle, that you've had good results with in the past. CeraVe is a good option. Cetaphil.
The moisturizer I use now is the Dermalogica one. Is that not a good one?
No, just look at it and make sure if it has any kind of acid in it. Benzoyl peroxide, salicylic acid, alpha beta hydroxy acids. You kind of want to steer clear of it just for the next 48 hours because it can be more drying. And you want something that's just going to nourish your skin and provide hydration, not something that's going to dry it out.
Okay. Alright, you guys, so this is how I look right after. Yes, I'm very red, but don't be scared and don't be alarmed. This is natural. This is how it's gonna look right after. So thank you to Jennifer for taking care of me. It was not painful, but I'm gonna let her speak really quick, and you guys come and check her out.
So this beautiful young lady had our PRP microneedling facial, also known as the vampire facial with the skin pin. She will be red, but the redness will be significantly better in about 24 hours when she wakes up tomorrow morning. I provide all of my clients with post-op instructions, as well as specific products to use that I like to use personally that will be really good and gentle for her skin. Don't be scared. This isn't a painful procedure. I promise you. All my patients get prescription strength numbing cream before. Usually everyone says pain score 1 to 2 at maximum for the procedure. Redness will get better, and in 3 to 4 days, her skin tone, texture, dark spots, everything's going to look better and better. It's recommended to get these every 4 to 6 weeks as needed, and it is one of my absolute all-time favorite treatments. I get them all the time. I do them to myself. They are wonderful.
Thank you so much.
Thank you.
Alright, you guys, check her out. Come see Jennifer, and